It's effective. It definitely gets stuff clean. So if you're a germaphobe and you're lazy, it's a great idea. So now, sorry, I hope you all the owners of those things in this room don't hate me. But is it more effective than standard cleaning? So, I mean, back in the day when, we would just recommend baby shampoo and water. Swish your stuff around, throw it over your towel bar, and, let it drip dry, and baby wipes. So I haven't seen any evidence that says that cleaning is better than standard cleaning. I haven't also seen any evidence that's good evidence that says that if you don't clean your machine every day with this thing, that you are going to become ill more often. And they've done studies where they even culture the water chamber, they grow stuff, but doesn't correlate to people becoming ill more often. So, and here's what I say. Like I said, if you're a germphobe, you're kind of lazy and you got $300, yeah, it might be a great choice. But we don't change our toothbrushes every day, and I can guarantee you if you culture one of those, it's going to be more disgusting than your CPAP, water tank. So that's my stance on it. I don't dissuade people necessarily, for the right person, but just, I don't know, does anybody have any other thoughts about the cleaning machines that you'd like to share with me? Any DME people out there that want to yell at me right now? I mean, my husband's got CPAP and he's not getting one for Christmas. So, well, he's not getting a lot of stuff for Christmas, but that's another story. All right, so, and just in summary, I think I don't need to read all this, but the home test, like I said, is to rule in obstructive sleep apnea, and it's pretty easy for patients. They would have to try really hard to screw it up, because you just wear this probe thing on your finger and turn it on. That's all there is to it, and bring it back. So, any questions about any of this? Yes, ma'am.
I noticed that you showed pictures of watch pad. So with the apnea dentures, the belt around the chest, and it's for the hypopnea of that. The watch pad doesn't take that out then.
No, the watch pad, her question is that it's the other home tests pick up the differences between hypopnea and apnea. And the watch pad doesn't differentiate between those two events. But at the end of the day, the treatment is the same. Whether or not it's hypopnea or apnea, they're still going to get PAP therapy. And so we use this device because it's so far it's the most straightforward, most foolproof, and the VA started using it. And because of that, we have.
I've been reading that women will have a tendency to have more hypopnea events than they do obstructive events. So are you missing something for that maybe treatment?
I don't know, because the hypopnea, when you have hypopnea, you're still going to have a CO2 increase, which is still going to activate the sympathetic system, which is what this is measuring. If a woman is, or anybody for that matter, is borderline, so their AHI is 4.8, and it has to be over 5, but they had maybe an 8 or 9% O2 SAT drop, and they're tired, then we'll probably send them in for a PSG anyway. So it's really meant to rule it in a very fast, relative to the sleep lab, to get a diagnosis quicker.
Is it using 2, 3, or 4%?
It depends on the insurance. So it can be scored either direction. So if it's Medicare, it's 4%. Some private, insurances use 3%. It just depends on the insurance. Yes, ma'am.
Sorry that insurance companies are paying for those in-home when, how can you dictate that patient's the one that's wearing that machine?
Well, I guess you're right. You can't.
Can you repeat that?
Yeah, sure. So she's asked if she's surprised that insurance companies are paying for a home test when you can't guarantee that it was the patient actually doing the test, which is a good point. I would say that there's really no way to monitor that, except that most people don't want this diagnosis. So,
We've only had one person do it so far, right?
yeah.
Which is like private insurance.
Most insurances they're more likely actually to pay for the home test versus the PSG. So the PSG can be, $4,000 or $5,000, and a home test is less than $2,000. And at the end of the day, you get a diagnosis. Like I said, the person sleeping next to you doesn't count. So that's sort of it's a very streamlined way of doing it. Yep.
So within this industry, do you see the home CPAP studies that are being done with the devices you ship with us today outweighing the necessity for a formal sleep study? Especially with the advancements in technology and taking into account the rate of reimbursement rates from insurance companies, et cetera.
Insurance companies, if it's just OSA, the home test will probably gain more popularity and momentum. If it's some kind of REM behavior disorder or narcolepsy or some other thing that's not going to be picked up by this kind of test, we'll always have to have PSGs. But it is, I mean, if it's something really straightforward and the treatment's going to be the same whether the diagnosis came from a PSG or came from a home test, if you're going to get a PAP machine, it just happens faster. So, yes?
I work for a hospital-based DME, and we have a sleep lab at our hospital,
Mm-hmm.
and we are not able to use HST.
Okay.
I work for a hospital-based DME that does in-lab sleep studies, and we do not do HST because of the Medicare rate.
Okay, so the company that's offering the test, so are you meaning that you would also treat the patient as well? So you can't be a DME and provide treatment at the same time, but you can be a hospital-based, and then the DME is a separate business. The University of Iowa Sleep Solutions, that DME, is not considered part of the hospital. It's considered a separate healthcare, I don't know what it's called. It's not the hospital. Greg, anything? Yeah, no, sorry.
Sorry, one more question, sorry.
Yes, Greg, so sorry.
So for patients with COPD, considering the increased morbidity, mortality with OSA, do you recommend, like with the COPD educators, that they just almost mandate a full sleep study for those patients?
Because you think it's more hypoventilation or hypercarbia or?
Because that patient population's at such risk for.
Yeah, I mean, if they're snoring and they're having witnessed apneas and they have hypertension and they're tired, yeah. No, I mean, no. Thanks very much, guys.
Okay, thank you, Lisa.